Good morning to you all. As usual, we're going to give you an update on the situation both abroad and at home. There are still a total of 188 countries with COVID cases. They have already exceeded 2,029,930 confirmed cases. We are already talking about 81,419 cases in a single day and a total of 136,320 deaths. The most striking figure is that of 10,354 deaths in a single day. That's a 6.7% fatality rate higher than yesterday's. In the region of the Americas, 37,655 confirmed cases were reported in a single day. 748,256 in total, and this represents 36.9% of the total number of cases in the world. Nothing more and nothing less than 5,380 deaths in a single day, for a total of 35,688 and a lethality of 4.76, higher than yesterday's. Turning now to the domestic situation, a total of 12,251 people remain in Cuba, of which 5,199 are foreigners and 7,052 are Cubans who reside abroad. In rental houses, there isn't really no major change. There are 957 foreigners staying in Santiago de Cuba and in the municipalities of Plaza, Playa, and Centro Habana, here in the capital, with the highest number of foreigners. A total of 2,734 patients have been admitted to hospitals. 259 are under surveillance, 1,777 are suspected cases, and 698 are confirmed cases. We are keeping 7,373 people in primary care surveillance, who for several reasons are under suspicion for contacts and so on. For the diagnosis of COVID-19, 1,480 people were studied at IPK Laboratory 856, in Villa Clara Laboratory 267, in Santiago de Cuba 196, in Havana 92, in the Civil Defense Laboratory 79, and the data from Havana already includes the first samples that were processed yesterday in the Molecular Biology Laboratory of the Genetic Engineering and Biotechnology Center that, as we explained yesterday, was incorporated into the study of samples. Of those 1,480 samples, 61 were positive for COVID-19, for a 4.1% of all the samples. In this way, our country accumulates 23,317 people studied and 923 positive cases, for 3.9% of the people studied. At yesterday's cut of these 61 new cases that were confirmed, all are Cubans. Of these, 57 are contacts of confirmed cases or suspicious cases that were already identified in our country, and the source of infection of 4 of the people who were confirmed is being investigated. As we have been saying for several days now, people are very insistent on knowing the origin of the infections. If sources are ultimately identified, to this end, epidemiological studies are carried out. We can say that a significant number of them are identified and they can be traced to a certain case, as we have also said that we have a group of them in which relationship cannot be established. This is an evidence of what we have been repeating all along about the level of contagiousness, the level of transmission in some territories of our country where our population has to protect itself very carefully. Of the 61 cases diagnosed, 36 were female. For 59%, a little more than yesterday, the female sex continues to predominate in these last 2 days. And what is more important, 67.2% are asymptomatic cases. These are those people who have been investigated because they have had some reference that makes them suspects, either because they have respiratory symptoms, but that person does not have any relation with any confirmed case or with any relation abroad, but that by protocol in our country, it is established that they are submitted to studies. In terms of the age groups, the confirmed cases, those over 60 years of age with 24 cases are 40%, and they are followed by those under 60 years of age, which amounts to 20 cases for 33.3%. I want to emphasize that the rate of youth, the rate, as I explained, takes away the effect of population. If it were by population, Havana has the highest number with 335 patients positive to COVID-19. And this is because where the population is concentrated. However, the rate removes that effect. And that is what allows epidemiologists, health professionals and technicians and our population to make the analysis. It is interesting to see how the special municipality of the Isle of Youth, with a lower number of cases, however, has the highest rate. It is followed by Villa Clara with 18.7, Ciego de Ávila. Havana occupies a fourth place, and Sanchez Spiritus has a rate of 12 per 100,000 inhabitants, and Matanzas with 7.5%. These are the provinces where a greater transmission of the disease has been detected with the highest number of cases. It is true that in those provinces we also have to analyze events and affected municipalities individually, because many times it is not the whole province, but it's on a municipality of that province or a given community of that province. I always give the example of a first event of that magnitude that we had in the Pinar del Rio province in the community Camilo Cienfuegos, where it was not really the entire province of Pinar del Rio, but only in that place as such. Of the 923 cases diagnosed with the disease, 681 show a stable evolution. An accumulated 31 deaths that have been reported, which is the figure that hurts us the most to report, but we have to give the information of four fatalities yesterday. We have 2 evacuees who are already known and 192 discharges, with 21 yesterday who are leaving with the protocol that has been established. 10 patients are reported to be in critical condition. 7 are from Havana, and they are 3 in the Naval Hospital, Dr. Luis Diaz Soto, and 4 in the Salvador Allende Hospital. In Santiago de Cuba, there are 2 patients in critical condition who are at the Joaquin Castillo Duani Military Hospital, and in Villa Clara there is 1 in the Manuel Fajardo Military Hospital. 7 patients are reported in serious condition. In Havana, 4 in the Salvador Allende Hospital. In Villa Clara, 1 in the Manuel Fajardo Hospital. In Camagüey, 1 in the Amalia Simeoni Hospital. In Holguín, 1 in the Fermín Valdés Domínguez Hospital. As I said before, there were 4 deaths yesterday. One was a 76-year-old male patient from Havana, from the Cerro municipality, with a history of high blood pressure and chronic renal failure. He was hospitalized for a diagnosis of clinical manifestations of prostate adenocarcinoma for surgery. He was admitted with a rapid progression. He presented respiratory manifestations and tested positive for coronavirus since April 14.
Tuvo una evolución muy desfavorable y lamentable fallece como
He
consecuencia
had
de un
an
fallo
unfavorable evolution
respiratorio.
and died from renal and
La otra
respiratory
paciente
failure.
femenina de 72 años que vivía aquí en La Habana Vieja, en La Habana, que además tenía
The other fatality
una
is a
insuficiencia renal
72-year-old
crónica,
female patient
grado
from
4,
Old Havana.
nefropatía diabética,
She had a
hipertensión
chronic
arterial,
renal
paciente que
failure
además
grade
se
4,
realizaba,
diabetic
hemodiálisis,
nephropathy,
que además era
arterial
contacto de un caso
hypertension,
positivo a COVID,
a
se
patient
estudió
who also underwent
y realmente, fue
hemodialysis.
confirmada, se mantenía
She was also
ingresada
the contact
y
for a
tuvo una
positive case of
evolución muy
COVID-19.
desfavorable. Además, con todas estas
She was
enfermedades,
studied, and actually, after it was confirmed, she was kept in the hospital and had a very unfavorable evolution with all these diseases, and she died as well.
que se encontraba
The
ingresado
third death we have to report is of a 78-year-old male patient, also from Havana, from La Lisa, who was admitted for high blood pressure, heart failure, diabetes mellitus, chronic renal failure grade 4, chronic hepatopathy due to virus C, who was on admission had respiratory symptoms.
se confirma como tal y se encontraba ingresado
He was
ya en el
tested
hospital
and
naval
he was
Dr.
confirmed
Luis
as
Díaz Soto,
positive to COVID-19. As a
siguiendo
carrier,
todo
he
el
was admitted to the
protocolo de
Naval
tratamiento del
Hospital Dr.
en una
Luis
sala
Díaz Soto,
regular
following the
intensiva,
entire protocol of
pero
treatment
lamentablemente,
of COVID in
fallece
an intensive care unit, but unfortunately he
el día
died
de ayer.
yesterday.
Y el
The
cuarto
fourth
paciente
patient
que
who
lamentablemente
unfortunately
falleció
passed away is
es un
a
paciente masculino de
83-year-old
83
male
años de edad
patient from Las Tunas
de la
who
provincia
had
de
a
Las Tunas,
thrombosis of the aorta and at the
síndrome de la eriza,
bifurcation
una
level,
trombosis de la
high
aorta a nivel de la
blood
bifurcación,
pressure, diabetes mellitus,
hipertensión
chronic
arterial,
renal failure,
diabetes mellitus,
and
insuficiencia
hypertensive
renal crónica,
cardiopathy, who was admitted for a study of some of his
que se
manifestations.
ingresa para estudiar
He presented
las
respiratory
manifestaciones que
symptoms
tenía,
during his admission.
presenta
He was studied,
durante ese
confirmed,
ingreso sintomatología
and
respiratoria,
taking into
se
account all these
estudia, se confirma, y
elements,
teniendo en
he
cuenta
died
todos
yesterday.
estos elementos que yo me he referido,
These are
pues
the four
realmente,
fatalities
tuvo
we
una
had
evolución tórpida
to
y
regret
fallece en el
from
día de ayer.
yesterday.
Estos
And
son
as
los
you can
cuatro-
see, all of them
los
had
cuatro
elements
lamentables fallecimientos
that
que
were
tuvimos en el día de
unfavorable.
ayer, que como ustedes ven, todos tenían algún elemento desfavorable. Hay inquietud con el tema del pico, en qué momento es el pico.
Before
Llamando el
taking
pico al
questions, there are
mayor
people
número de casos. Y hemos dicho otras veces, además, se
who
ha
have
dicho, se ha
approached
explicado en la-
us
en la
with a
mesa
concern
redonda
about the moment
que se han-
of the peak
que se han realizado
or
en relación
when
con este
it's
tema,
going to occur.
que se espera que a
Understanding
mediados
as
de
the
mayo
peak as the
tal
moment
vez
when
el
the
pico,
greatest
se hablan
number
de
of
cifras de
cases
30.000
occur, as we have said before.
Nosotros nos
This
estamos
has also
preparando,
come up
como también he
at the
dicho,
roundtable
nosotros,
programs that have been aired
el
on
Ministerio
this
de
issue.
Salud, todos los
The peak is
organismos y el
expected to
Estado
be
cubano
in mid-May,
para el momento
talking
que
about
eso
a
se
figure about
Y
30,000
también tengo
cases.
que decir, porque
We are
reiterar
preparing
que
ourselves, and when I
trabajamos
say
para
we,
que
I am
ese
referring to
pico
the Ministry
cada
of
vez sea,
Health, of all the
más
agencies
aplanado,
of the
o sea,
Cuban
que
state,
no tengamos
for the
un
moment
elevado
when
número de
this
casos. Ustedes dirán,
happens.
bueno, y
We
si
have
están
said
haciendo
that this
todo
disease
porque
has very particular characteristics which we have not seen until now, not even with the arboviruses. Special characteristics of contagiousness and transmissibility, which, despite the measures taken, they are often difficult to control. Therefore, the waves, the peaks, the Cuban government has been taking the restriction measures so that depending on the evolution of the disease and its magnitude, and what we're doing is trying to see if we can bend the curve so that we have the least number of cases. The question is, the Cuban doctors who work in other parts of the world, can they talk to their relatives, or do they have information from them on a daily basis? Is it possible for them to communicate from all countries? Yes. All the doctors are communicating. We are in the age of communication where communication has a certain level of ease, and they do keep in touch. We have seen reports on television reporting on the places where they are and the communication they have with their family. They do keep in touch. I remember at the beginning of the epidemic that there was a Cuban student who was no less than in the city of Wuhan, in the province of Hubei, at the beginning of the epidemic. And I visited her family, her mother, at that time. That young woman did not get out of that place. She kept herself from getting sick. I remember that I interviewed her family, and they were in constant contact with her. They saw her, they talked to her, they showed me pictures of her doing exercise in the house to keep in shape. That is, there is a communication with all of our professionals and technicians who are in all the countries where they are at present.